Hello to all our audience joining us from around the world. To meet the SDG target for maternal health, the global health community must work collectively in support of locally driven solutions that ensure women receive essential, high quality, respectful maternal health services, wherever, whenever, and however they seek care. MSD for Mothers launched the Strengthening Systems for Safer Childbirth initiative last September, with a focus to include contributions from local private health systems and health providers. Temitayo Erogbogbo, Global Advocacy Director, is joining us today together with the CEO of Unjani Clinics, Lynda Toussaint, to speak with us about her organization's experience with innovative financing that has helped the organization to scale basic primary healthcare in South Africa. Thank you for joining us today, Lynda and Tayo. I'm going to start with Lynda. The success of Unjani Clinics is amazing. It's a nonprofit organization improving access to healthcare in South Africa, and it has grown exponentially from 6 pilot clinics to over 90 right now. And then your goal is to achieve 600 by 2030, if I'm correct. And with this, success story, we wanted to ask you to tell us a bit more about how are you planning to scale to get to those 600 clinics, and how private investment capital can help you achieve that.
Thank you very much, Raquel, for the opportunity, and good day to everyone. So Unjani Clinics, a non-profit company, is the organization that I run, and we were established solely to fund or raise funding for, implement, manage, and build the Unjani Clinic network of clinics here in South Africa. And none of what we've been able to achieve would have been possible had it not been for the funders and donors that have provided the capital for us to be able to open those clinics, really test the model from, as you mentioned, the 6 pilot clinics back in 2012 to where we are today, heading for 100 clinics by the end of 2021. And really, the funding that we have received, particularly from the MSD for Mothers Moms project, has helped us stop as a non-profit company and have a look at where we are and what is the opportunity to grow, and really look at what is possible, and be able to then implement that growth path that you've just mentioned. We've also looked at how we frame that differently. We've originally spoken about 1,000 clinics and have done a lot of work around whether that is possible, because it's always good to put possible or achievable targets into your plans. And we've done some work with a number of organizations to see what is the possible number. And so we've worked with 600 as opposed to the 1,000 because it's a more realistic target, but also looking at other ways in which we can achieve the ultimate target, which is really about the lives that we impact. And so does it have to be through a facility? It can be through other opportunities, such as the use of virtual consulting to reach more rural areas, so you can still impact lives but not necessarily have to implement a facility. So we're looking at various areas, but none of what we've been able to do would have been possible had it not been for the Moms funding, to be able to have a look at what is realistically possible, to build the non-profit company, to be able to ready ourselves for that scale. And it's really encouraging because, you've got private sector alongside the donor organizations trying to really achieve those SDG goals. And that for me is crucial, that, and we've seen that in the COVID environment, that you cannot do anything in silos. You have to work collaboratively across organizations that are able to provide capital, be it private capital, be it donor funding, and then organizations such as ourselves that have models that are able to be implemented and rolled out, particularly in South Africa, which is our focus, but also in other parts of the world. So, that is really how we plan to do this. And it really wouldn't be possible if it wasn't for the private sector and the donors in the private sector facilitating the ability for us to be able to scale this.
Thanks so much, Lynda. Actually, zooming in a bit into the health system of a country such as South Africa, could you tell us a bit more of why is so important this role of the local private sector providers as your own organization in adding both capacity and efficiency into the system?
Yeah, it's a great question. So we have about a population of 60 million people in South Africa. More than 80% of that population is reliant on our government for the provision of their healthcare. There's only about 10 million people in our country that can afford private medical insurance and can look after their own health needs because of affordability. And so Unjani clinics, the idea and the concept was built out of two things. One, the shortage of doctors that we have in our country, and the need to task shift to professional nurses to deal with primary healthcare issues at community level, and then two, the fact that we have so many people reliant on the government facilities and they are over populated. Service delivery is an issue. And so really what we want to do with this, or have done with this initiative, is be able to provide an alternative choice to the the uninsured employed population of South Africa. And that's also about 10 to 12 million people that fall into that population. And so if we're able to draw those people away from the government facilities to Unjani clinics or similar kinds of private initiatives, you then are capacity building in that the government is then left to deal with the unemployed, the destitute, those that cannot afford to cover their medical requirements, and then obviously we're putting facilities into communities, so you are health system strengthening in that way too. So it really is providing your low-income populations with an alternative choice that is affordable and is accessible to them within their communities. And so the idea was never, we do not compete with government. We offer an alternative to the government facilities, but also work with them across programmatic change and build the South African health system in that way.
Thanks. I know, and I think all our audience might also be familiar with this, Tayo, that MSD for Mothers wants to leverage precisely the local solutions and local health providers. I know, as we were saying, that you have recently launched the Strengthening Systems for Childbirth initiative just last September. And I wanted to ask you a bit of the motivation behind launching this new initiative.
Great, thank you so much for the invitation to be here. It's a real great pleasure to be on this panel with Lynda. And so MSD for Mothers, as some may know, is a philanthropic initiative by Merck & Co., otherwise known as Merck for Mothers in the US and Canada. And our goal is to help reduce maternal mortality across the globe. And in that regard, one of the strategic focus for our initiative is how do we leverage or strengthen the capacity to respond to maternal health needs. And we believe strongly that private sector has a role to play, which is informed by not only their own capacity, but actually the health-seeking behaviors of women in a lot of lower middle income settings, where 40 to 70% of women are already accessing service through local private providers. But the Strength System for Safer Childbirth initiative was really, we're motivated to launch this initiative by four things. One is the fact that we are really behind in terms of are meeting the goals for the SDG 3.1. At the current rate of progress for Africa, as an example, we will not be able to hit the SDGs target until 2085, which is clearly not good enough. So there is a need to actually help accelerate the progress towards meeting that goal. The other is something that Lynda was speaking to around the funding gap. The Global Financing Facility estimates that there's something like 33 billion annual deficit in terms of RMNCH funding annually, which government just don't have a capacity to meet, especially in right now where we've seen real challenges in terms of response to the pandemic, which puts an initial strain on financing budgets. And then there's also the fact that basically when we invest traditionally or as a global health community, too often I think we've prioritized driving solutions and not looking at local community needs and responding to those needs. Lynda mentioned earlier on about there are different ways of actually addressing local needs beyond building a clinic. And how do we do that in a more strategic way, whereby we can leverage the local capacity that is there deliberately to help to respond to needs of the community. So those are sort of like the drivers behind the Strengthening Systems for Safe Childbirth initiative. It's really an effort to help really focus our efforts on strengthening the local capacity that meets local needs and is informed by local needs.
Thanks so much, Tayo. My last question to you would be, what kind of response, what kind of expectations do you have from both the donor community and the development community as a whole in front of the challenges that you just explained? And kind of like what else can they do to join your efforts?
So MSC for Mothers is committing $25 million over the next 5 years to the for the Strengthened System for Safer Childbirth initiative. And what we would like others within the donor community to do is to join that initiative in making further commitments that can help us to do more to strengthen the local capacity to respond to the maternal health needs. Our focus is around Nigeria, Kenya, and India, but we are open to suggestions in terms of investment in other geographies where we can pool resources together to be able to do more for mothers.
Thank you so much, Tayo, and thank you as well, Lynda, for joining us today. Thank you to our audience for listening in and for participating. Next, as both the speakers were saying, is to take action. And next, you have a panel about development finance and climate change. Thank you very much for joining.